Members of the European Parliament, distinguished guests and colleagues, a very warm welcome to everyone both here in person and those joining us from around Europe and beyond. It's great to see so many countries being listed in the chat box, so thank you for being with us. My name is Esther-Mary Darcy. I am the chair of the European region of World Physiotherapy, and I am delighted to be here today at the European Parliament event to highlight the role of physiotherapy in mental health. I would like to start by thanking the members of the European Parliament, and in particular our host, Mr. Agius Saliba from Malta, and Ms. Maria Walsh from Ireland, and indeed a near neighbour with whom we have been collaborating. And I thank you for setting up this meeting today. I am most grateful to you. And thank you indeed to our secretariat in Brussels, to Aitor Carpio Garcia, the CEO, to Eleanor Rock and to Miguel Perez. In our concerns about the prevalence of mental health in Europe, we have specifically targeted the need to enhance the awareness of the role of physiotherapy in people with poor mental health. We established, as a result, a specific working group in the region on mental health. And as well as the executive board members and co-chairs, Katri Parchanen from Finland and Maria Busuttil from Malta, who is the moderator today, the group comprises Tien van Dem from Belgium, Tanja Balk from Finland, Didzis Rosenberg from Latvia, Patrick Conrad from Slovakia, and Christine Bravo Navarra from Spain, who will speak later. These physiotherapists are leading in the area of mental health in their respective countries and have been actively involved in preparing for today's session. And I am grateful to them for bringing their expertise and indeed their voluntary time to the working group and here today. At a global level, World Physiotherapy, of which the European region is a part, has a specialty group in mental health, which has physiotherapist member organisations from 25 countries around the world. And I welcome current president of the group, Daniel Catalon, Matamoros from Spain, who is joining us today. We have also received good wishes from our World Physiotherapy president, Mike Landry, who regrets that he is unable to join us due to being in transit between conferences. Physiotherapists in the Europe region have been working with several mental health related groups in our respective countries and in the EU. And I think it's great that the European parliamentarians have their own group with an interest in mental health, who come together to advocate for better services throughout Europe. I think this really demonstrates the important value that our parliamentarians place on mental health, and we look forward to continuing work with you. I welcome the communication adopted by the European Parliament in June of this year on a new and comprehensive approach to mental health, focusing on the three guiding principles of access to adequate and effective prevention, access to high quality and affordable mental health care and treatment, and reintegration into society after recovery, all of which involve physiotherapy. So I also welcome the Commission's move to ensure that health interview surveys will now include questions on mental health, which will give us a more accurate extent of mental health among EU citizens. The current estimate is 84 million people in Europe experience mental health issues. This is a staggering 1 in 6 people. And of course, it is more common in many groups who are already vulnerable: children, adolescents, young people, older people, people with disabilities, people struggling with addiction, with gender identity, those without a home, as well as refugees and migrants. The mental health of young people is a growing concern, and this is an age group that often fall out of physical activity and sport at a time when in fact it would be of greatest benefit to their mental health. So we must, and as physiotherapists, we make concerted efforts to support and empower young people to remain in sport or a physical activity that they enjoy. As physiotherapists, we can make every contact count with people whom we treat and empower individuals to take up some physical activity, as well as enhancing functional movement awareness, and prescribed exercise plans for people who need more specific intervention. The biggest triggers at the moment for mental health, as we all know, have been the pandemic, the financial situation, and the war in Ukraine. These also put huge strain on the mental health services. And Hans Kluge from WHO Europe has mentioned the workforce shortages in the health service and in mental health in particular. Europe has also outlined the importance of physiotherapy in supporting mental health services. As the recruitment of health professionals becomes increasingly difficult, physiotherapist skills and interventions are effective, they save time, they are non-pharmacological, they are non-invasive, and therefore less expensive. So our involvement also frees our medical colleagues to treat people who have more complex mental health needs. The evidence for physical activity benefit for people with mental health issues is irrefutable. Many people with poor mental health also have other conditions such as chronic pain and arthritis, contributing to immobility, loss of independence and confidence, and all of which can lead to a deepening of their mental health symptoms. So our role contributes to both preventing or treating that cycle. I heard that the First Lady of Ukraine yesterday talked about the project in her country in terms of asking people, how are you? And really meaning it. This is a question that we often ask, but do we wait for the answer or do we hear the answer? But in Ukraine, the intention is to make sure that the person who says they are okay are actually okay. And yesterday also, the Commissioner stressed that we shouldn't have silence around mental health and that it's actually okay not to be okay. So does okay mean we are okay? And it's okay not to be okay? And the role of all of us is to assist when someone says they are not okay. Our role as physiotherapists will be shown today by Dr. Cristina Bravo-Navarra on behalf of all the physiotherapy experts in mental health in Europe. And I hope that it will widen your awareness and knowledge of how physiotherapists can greatly contribute as providers of mental health services for our European citizens. Thank you.
Thank you, Esther-Mary, for a very great welcome and introductory speech. I am observing you covered up nicely the messages that were conveyed to us yesterday during Mental Health Day. So I thank you for sharing it as well in this plenary. Next speaker is another Maria in the house. There are two Marias today. It's MP Maria Walsh from Ireland. Maria has been a Fine Gael member of European Parliament of Midlands Northwest since 2019. She's the co-chair of both mental health interest groups in the European Parliament and advocates tirelessly, I agree with that, for both a dedicated EU mental health strategy and an EU year of mental health. She always takes stances on mental health policy and legislation that align with her values of inclusion, equality and respect, even if this entails some difficult conversations with her colleagues. Maria aims to ensure the better delivery of a proactive mental health service to our citizens, particularly young people. Maria, the floor is yours. Thank you.
You're so kind, and thank you so much for having me, and delighted to be joined here with Alex and you all, and I know those online, and it's always great to follow after another Irish Esther-Mary, and as you were saying that, your backdrop looks a little bit more academic than mine would if I was at home or in the office. So. But as you were talking there, I was scribbling notes of what you were sharing, and the "How are you" piece is a testament to our Irish culture. When we walk past people, and I catch myself doing it all the time here in the European Parliament, hi, how are you? And as another community member or another country is stopping to slow down to answer the question, I continue walking, because that's how we check in with people in Ireland, and actually just reminded me to stop doing that. So thank you for educating me, Esther-Mary, on that. But I have a more formal speech to share, and let me just wish each and every one of you a very happy World Mental Health Day. While yesterday, I think we can, I think it's every day how we show up in ourselves. So it's probably something we should be saying every day and not just yesterday. But as my fellow Maria shared, Maria Walsh is my name. And for those connected online, I just wanted to give you a little stance on to who I am and where I'm coming from. I cover a constituency called Midlands Northwest, which is essentially Galway to Donegal, Mayo, across to Louth, half the country bar Northern Ireland. That's the geographics. Very broad and diverse, from urban and rural, extreme rural, and then very built up areas. And within that, just under 1.5 million people. But I come from a very rural community, and my relationship with mental health is something that I often see and feel we need to, I like to share when I'm at events like, in conversations like this, is within a very small rural community, probably the size of this room. Sadly, we had lost a number of lives through death by suicide. A father of one of my classmates being the first that I recognized. And I was really struck at the fact that nobody talked about it. Particularly adults. Our language around mental health just seemed to be brushed under the carpet, and the more and more I began to tear away at different elements as to the why, our legacy of mental health in Ireland has never been something that I'm proud of. But as I hope Esther-Mary agrees with me, we've shifted that, and we're beginning to have more and more open dialogue and being part of conversation. And I have to give credit to our relationship with the European Union some 50 years ago when we joined, that conversation began to change, because we saw the care economy and social supports as a much more prevalent and much more urgent matter than just economic. But as I digress, and my team is probably panicked because I'm not sticking to my speaking note in front of me, I'm going to go back to that and say, I think everyone in this room and online agrees with everything that I'll just share here, but mental health and our barometer of it and how we deal with it impacts every aspect of our lives. Education, how we show up in employment, how we show up in our personal relationships, be it platonic or romantic, what our addiction is, be it food, alcohol, drugs, or the busyness. Stress cortisol is probably one of our greatest addictors right now, and yet we don't highlight that enough. And that, of course, is an underlying mental health challenge that we all have to address and face as a society and as an individual. And by not approaching mental health, and Alex is probably tired of the teeth of me always saying this at our meetings and events, but by not approaching it in a horizontal way, we have this two-tier society. And again, linking back to the country I know best, Ireland, you have those who have access to the likes of physiotherapy or mental health supports or different services, and those who unfortunately don't. And the imbalance is where we definitely need to find our place of support and gatherness. It isn't only by making mental health a priority in every area of policy making or our roles in society that we can really find the solutions to problems. And just as Maria and I were talking even yesterday at the Commission event, and hearing Esther-Mary and no doubt the other speakers, there's so much work to be done of connecting all the dots of all the work, particularly within the physiotherapy world. Many of you already know that the Commission launched communication on the comprehensive approach to mental health. We really like to pack in as many words as possible into stuff. Apologies if anybody from the Commission is in this room right now or online. But it's really positive to see, because I think when we started in 2019, the fact that we have an EU Commissioner who herself is a child psychologist by trade in terms of Stella Kyriakides, I think has allowed us as a parliament to really put more emphasis on mental health. And the fact that probably one of the only silver linings of the COVID pandemic was the fact that everybody woke up to the fact that everybody has mental health. And we are on that that crossroads now where the urgency needs to be met, and we're certainly eager to meet that meeting. But I just wanted to flag one or two things that the Commission had launched in part of their communication, one being best practices portal, where civil servants within health systems, as well as civil society actors, can share what works on the ground across Europe, and that's one of the best in class. How that will be delivered is ultimately where I think we as a group need to decide and what we need to inject into and make happen and put the pressure on. But in 2024, I know the Commission will provide that technical layout and that support to Member States to design and implement reforms, and that's where I'll ensure from my side your voices is certainly heard at that table, because we so desperately need. A number of other good few initiatives in the communication around prevention and mental health promotion. As Esther rightly pointed out, 1 in 6 European citizens. I take that statistic and I also add to the fact that the second leading cause of death right now in the European Union for young people is death by suicide. Yesterday, I heard startling statistics from the UNICEF ambassador saying in 10 years' time, if I'm quoting him correctly, we'll see depression as the leading cause and the leading concern worldwide, which is staggering, because a lot needs to happen in 10 years for us all to show up better for each other. Maria rightly pointed out, Alex and I are co-chairs of the Mental Health Interest Group, as well as the coalition and a few other things that are going on in this Parliament in relation to mental health. And I know Alex will probably talk more from employment side and labour side. But we work on the work-life balance, the right to disconnect. We had an own initiative on the digital way of work. So there's a lot going on. It's just essentially, I think from our side, the more and more groups we meet like you, the more and more we understand, what layout and what scale that you would like to support in and add into. Also, I could go on, and I probably should, because there's a lot of great text in front of me from my team, but I'm really conscious of time, and ultimately I don't want to be an atypical politician that Esther-Mary and I know in Ireland, where I'll take up more space than I should. But I just want to say how grateful I am to be here. Really delighted to be having this conversation and be involved. From numbers' sake, we have about 5,610 physiotherapists in Ireland. I'm probably a little shy on that number. Esther-Mary's books probably will tell me a different number, but every role of us has we all have a role to play, is essentially what I'm trying to put across, and I'm really happy to champion with you all, not just in Ireland, but across the EU, to making that happen. So thank you very much.
Thank you, Maria, for a very interesting overview. We do look forward to collaborate for sure, and I'm sure this is a good week where we have finally connected personally, not just through the online meetings. Definitely take-home messages to interpret the famous mental health strategy. Those 20 flagships are going to keep me quite awake for a couple of nights to see how we are going to include them in our policy documents now that we'll be presenting them in May through our general meeting. So we commit to that. And we'll see a bit how we can actually, make them adaptable for the physiotherapy profession. So next one in line is a friend of mine, Alex. Thank you for having us today. I've been knowing Alex now for quite a while through our previous jobs, but I am very happy to see him here in this plenary doing so much work, a hard-working colleague for sure, since I've been knowing him. So Alex obviously is from Malta. I think you got that bit. And he was elected in the European Parliament in 2019 on behalf of the Labour Party. After being successfully elected to the European Parliament, Alex has been serving onto the Committee onto the Internal Market and Consumer Protection, the Committee on Petitions and Coordinator, and later as its Vice Chair. He's also serving on the Committee of Employment and Social Affairs and the Committee on Industry, Research and Energy. In addition to his committee assignments, he is part of the Parliament's delegation to the ACP EU Joint Parliamentary Assembly, Delegation for Relations with Palestine, and to the Parliamentary Assembly of the Union of Mediterranean. Alex was also appointed as co-chair of the MEP Alliance for Mental Health and vice president of the Biodiversity, Hunting and Countryside Intergroup. Alex is the Vice President of the Socialists and Democrats at European Parliament, and he was also appointed as Rapporteur on the Digital Service Act, common charger, and on laying down rules to prevent and combat child abuse for the Internal Market and Consumer Protection Committee. He was also appointed as rapporteur on the right to disconnect by the Employment Committee and the protection of persons with disabilities by the Committee on Petitions at EU Parliament. He is the co-chair of the Mental Health Alliance at European Parliament. Since the beginning of this term, he strongly supports and advocates for a dedicated EU mental health strategy and EU Year of Mental Health. Alex, the floor is yours. Thank you very much.
So, first of all, thanks, Maria-Louisa, for being a strong advocate to be here today. I think it's really important during this week where we are celebrating and we are also making it a point that mental health is not only an issue to be celebrated once every year. Mental health is here with us. It is with us on each and every day of the year. And we as legislators, I think that we have a very important role to play with a number of key players in this regard. And I believe that physiotherapists play a very, very important role in all of this. First of all, I think that the most important message, and Maria has also rightly pointed this out, you never tire me. That we always have to take a horizontal approach when it comes to mental health. So we cannot take and discuss mental health in different silos, but it is a subject which is interlinked with employment, social affairs, with health, with environment, with sports, with many different issues that here in the European Parliament we tackle on a daily basis. I personally started appreciating more the importance of tackling mental health in a horizontal way when I was appointed rapporteur on the right to disconnect. And you start seeing also the ripple effects of actions that we can take here in the European Parliament, which can positively affect this pandemic that we have. Having a situation where, and we are always repeating it this week, having a situation where at least, and I always use the word at least, 1 in 6 people, citizens in the European Union is affected by mental health issues. I believe that the number is higher than that, much higher than that. But statistically, that is the number. I think that we are facing an ongoing pandemic and we have to do something about it. And that is why we are being so strong with the European Commission. We are pushing so much with the European Commission, ultimately to publish this mental health strategy, to have this a year dedicated for mental health, to continue to increase awareness, to continue to fight the taboo that still exists in many member states when it comes to mental health. It's useless. Although this week we are getting a lot of visibility, although this week we are hearing a lot about coming out, seeking help, there's nothing to be ashamed of. Another week will pass. Next week we will be seeing fathers, mothers, children, young children, who will be facing these issues alone without seeking help. And that is the worst thing that you can do. I also passed personally from a number of issues. I sought help. I had my treatment. Physical health was something that really helped out when I was passing from a dark patch. So that is why I truly believe that physiotherapists here play a very important role in bridging mental health with good health fitness. Let's put it like that. And you are the professionals who can guide us best in this. So it's really important to link these two issues, and ultimately I will also be advocating that this will form also a part of the EU mental health strategy. You have an integral role to play, not to try to fit in different proposals, but to be central in the strategy. Because ultimately doing exercise, doing the right exercise, having the right physical treatment also can ultimately treat a lot of issues that we are facing. And I think that this is really important. Yesterday I was hosting another very important conference, and again, continuing to confirm the important statement made by Maria, the horizontal perspective that we should and we must take when it comes to mental health. We were linking the issues of pain, chronic pain, and mental health, and their correlation, and the role also that physiotherapy can play in all of this. When it comes to pain, the effects of mental health, social exclusion, depression, and all the issues related with these conditions. Therefore, it is of utmost importance to have this discussion today. When I was looking at the program, the thing that I appreciated most is having patience to speak out from their testimonies, from what they passed through, how physiotherapy helped them, at least in a non-clinical way, to be able to address their challenges. Therefore, for us legislators, I think this is a wealth of information, being here today, sharing these experiences with key players, with patients, with professionals, to be able to better understand the realities that we are facing. Basically, exercise plays a major role when it comes to reducing depression, reducing stress levels. Exercise reduces symptoms in people who suffer from depression, from anxiety, from stress. And I am a firm believer that physiotherapy has a direct link also to increase these happy chemicals. I'm not a technical person, but these happy chemicals in our minds, which can help us to be more positive, which can help us to get out of this dark shell that each and every one of us finds himself in from time to time. Therefore, apart from psychology, psychiatry, I think that physiotherapy is also a key player when it comes to having a healthy European citizens also in this regard. This is all from my end. I don't want to go into long speeches. I just wanted to make short introductory remarks when it comes to why we are here, and to give a word of courage also to the World Physiotherapy Organization, especially in the European region, to be major stakeholders when it comes to this discussion. From personal experience, from the experience that I had with a number of people, constituents, citizens, multi-citizens, who use your services, maybe indirectly, without directly telling you that they were passing from dark patches in their lives, but the positive effects that you can leave, and the positive mark that you can leave in people who are passing from bad mental health, I think it is really important, and we should continue to put more light on this particular aspect from our end. I think Maria will definitely join me when it comes to the strategy, when it comes to the consultation. We will be pushing forward, not for you to be put in a box when it comes to our objectives, but for you to play a central role when it comes to the strategy, because this is of fundamental importance. Statistics are shocking, but the real situation on the ground is much, much more shocking. As Maria has rightly pointed out, I am tired of hearing cases of friends, of people who I know that ended up in a situation where they have resorted to suicide. This is not only a Maltese problem, this is not only a European problem, this is a worldwide problem. So we have to do everything in our power, everything in our hands, using also your services to try to tackle the problem, first of all, when it comes to prevention, but also when it comes to cure, because you play a role in both prevention and also cure. Thanks a lot, and I'm really looking forward to hear from stakeholders, professionals, but also I'm more excited to hear directly from patients.
Thank you, Alex, for a great intervention. You touched upon something that I think that as physio workforce we need to be looking into, the fact that we are helping patients who are passing through a dark patch, and we are perhaps not aware of their situation. So perhaps through our subjective examination, we can acquire more skills, whereby the famous "how are you" question, as Esther-Mary rightly said before, we look into it deeper and we know actually how we are impacting our patients, and perhaps we know that mental health has become a common comorbidity. So in Malta, our typical question is if you suffer from diabetes, because we know we have it a lot. So we could lead our subjective to a way where we could be well informed of the status of the patient within mental health with regards to how we can even follow up and through discharge pathways, through community referrals, in a way to safeguard better. And as you rightly said, we avoid risks of suicides. I mean, we live in a very small country. We've had a very bad summer last summer. I think we heard of family and friends nearly every week. There was a point in time where we couldn't hear anymore in a very small country where everyone knows each other. So I do feel your sadness about it, because I passed through it too. And as profession, we commit to perhaps looking at further competencies within our subjective to be able to know more what and who we are dealing with. So the how are you question, Esther-Mary, here is going to keep on coming up as well, probably in our discussions, in our working group meetings. So thank you, Alex. Now I pass on the floor to a very dear colleague of mine, an expert in mental health. She has been, valuable in my professional career because she taught me so much in the past year about what we do as physios. I'm a physio, but obviously always glad to learn further on what our services can render and our profession can render. She is Dr. Cristina Bravo from Spain, a colleague physiotherapist who is an expert member on our mental health working group, a tireless member, may I comment, of the European region of World Physiotherapy. She lectures and researches at the University of Jeddah and a member of the research group in health belonging to the Jeddah, who has also a foundation that focuses on research. She's the Vice Dean of the Spanish Association of Physiotherapy and Mental Health in Spain. Cristina, the floor is yours. Thank you very much.
Thank you very much, Maria, and good afternoon to all. I'm Cristina Bravo, and it's an honor to be here and to have the opportunity to address you in this European Parliament for Mental Health Day. I'm working in the mental health group of European region of World Physiotherapy, and I want to talk about the perspective of physiotherapy in mental health. Thank you. The purpose of that talk is providing an outline of the role of physiotherapy in mental health service across the European region. Here, there are my colleagues from working group around the European countries. As Esther-Mary said, we are leading for Maria, Busuttil, and Katri Partanen. Next. Okay, to start, I would like to provide the definition of physiotherapy in mental health to understand the role and the function that can be coped by the physiotherapists in mental health. Physiotherapy is the art and a science of applying physical agents for the promotion of individual overall health, prevention and treatment of mild, moderate and severe mental health conditions, as well as acute or chronic conditions and rehabilitation of their consequence. Physiotherapy also in mental health is person-centered and provide for children, adolescents, adults, and older people. Physiotherapy are present in primary and community care in inpatients and outpatients. The special theme or speciality is the create a therapeutic relationships to provide assessment and service specifically related to the complexity of patients with mental health for applying a model including biological and psychosocial aspects. Also, physiotherapy in mental health contribute the multidisciplinary team and the interprofessional care based on the available scientific and best practical evidence. Thank you. The main aim or specialty is optimize well-being and empower the individual by promoting functional movement awareness, physical activity, and exercise, bringing physical and mental aspects. Also, not only that tools we use, also in order to establish effective therapeutic relationships, we use relation factors and group therapeutic factors. We can work individual and in groups with our patients, and these tools are essential for the treatment of our patients. Okay, physiotherapy is the bridge between physiotherapy, mental health is the bridge between somatic or physical health and mental health. The latest evidence in neuroscience shows that chronic conditions are related with mental health states. And it is important to have the global view of our patients and not only physical aspect, not only mental aspects, it's a whole individual, and we treat whole the individual. What's more, physiotherapy, implementation of physiotherapy, mental health has a long and a strong tradition for more than 50 years in education and clinical practice. The first region that developed physiotherapy mental health was Scandinavian countries. And thanks to the influence of philosophers and psychoanalysts such as Wilhelm Reich. There is no health without mental health. That was the slogan, the last slogan of our last International Congress. And the mental health is an integral part of the health, and the physical and mental health are intertwined. For example, when you have a problem of physical issues, like breaks a foot and has to rest for a month, your daily life stops, and maybe you can feel anxiety and depressions. On the other hand, when you are depressed, you have a specific posture. Is studied scientifically. Your posture is shoulders and head forward sometimes, and you have less activity, which can affect your musculoskeletal system also. Thanks. In this slide, you can see an image. It's in Spanish, but I translate. The first two say it's medication and surgery, and when the other window says lifestyle changes. Yes, physical activity shows as the best non-pharmacological intervention in several conditions. A sedentary and inactive lifestyle is one of the major issues regarding mental health. There are significant associations between amounts of sedentary behaviors and increased psychological ill-being as a depression, and lower psychological well-being as a satisfaction for life and happiness, almost even in children and adolescents. Lifestyle change and self-care are our priorities as a physiotherapist through the patient empowerment. This is important for us. Thank you. Why is physiotherapy relevant in mental health? Physiotherapy mental health is an emerging field within the professional to address the current healthcare needs of society, especially in the aftermath of the recent pandemic, as our colleagues explained before. Also, it is a specialized area of physiotherapy that relies on scientific evidence. Derived for practical clinical interventions are thoroughly reviewed and evaluated based on scientific criteria. Our role are integrated as a part of multidisciplinary team, which includes psychologists, psychiatrists, nurse, occupational therapists, and others. It is important because we have only one piece of the cake, and it's important to collaborate with other professionals because there are a big complexity of our patients, and it's important that our colleagues know how we work and how we work the other colleagues from the multidisciplinary teams. And the last one is professional development. It's crucial to define the responsibilities and the competence of physiotherapists in this specialization carefully. It's important to, in order to integrate our specialty in the multidisciplinary team. Okay, that slide explains an example of our proposal for the European Commission. We have submitted a strategic proposal to the European Commission to promote physical activity and education for the prevention and treatment of depression in adolescents. As Alex says, it's very pandemic problem, the suicide and the depression of adolescents. And there is substantial evidence supporting the use of physical activity in depression treatment. To incorporate physical activity on their daily lives could improve substantially the symptoms of depression and can be part of their self-care. This is a key point, important point, because it's important that the people have managed their symptoms, and we can help to motivate with motivation strategies and other tools for them. Okay. That slide explains another project from the European region of physiotherapy. In physiotherapy. This project aims to promote physical activity in older individuals through the smartphone technology. It has been successfully implemented in Italy and in Spain, with a high level of acceptance among participants who appreciate both physical activity and the relationships through the implementation of this intervention. That intervention was conducted in a group setting supervised by physiotherapists. And now we can see the video.
Io sono Lola Valginigli e sono una pensionata attiva nel sindacato pensionati della CGIL. Il mio ruolo nel progetto Enable City come figura ponte è quella di promuovere l'attività sul territorio insieme al comune e al quartiere Savena, dove si svolge la sperimentazione. Sono una figura ponte tra il comune e la società civile per promuovere, anche per trasmettere, comunicare, veicolare anche delle informazioni corrette sulla salute e il benessere delle persone. L'app è molto semplice e ha dei contenuti anche scritti, ma con una narrazione molto amichevole. Partiamo. Quelli sul posto portiamo avanti. È bello stare in gruppo perché poi fra di noi ci aiutiamo con l'app. Queste piccole innovazioni vanno considerate come medicina di territorio.
Sono Alvise Saccon, kinesiologo. Mi è molto interessato il progetto perché è una sfida per diffondere l'attività fisica negli anziani attraverso un'app, perché è un progetto innovativo e inoltre prevede lo svolgimento delle attività outdoor, che è importante per il benessere degli utenti a cui quest'app si rivolge. Il mio ruolo in quanto Physical Activity Manager è stato quello di gestire attività fisica di gruppo di circa un'ora e di portare i partecipanti all'utilizzo dell'app in modo tale da a fine progetto essere autonomi e praticare attività da soli con l'utilizzo del telefono. Nel corso della sperimentazione i progressi principali sono stati quelli nelle capacità di equilibrio e di coordinazione, nella propositività e nel senso di comunità che i partecipanti hanno provato nelle attività e soprattutto anche nell'utilizzo dell'app e l'utilizzo dello smartphone. Ritengo che la partecipazione a questo progetto sia una grande opportunità per i partecipanti, perché avere un'applicazione che hanno sempre a portata di mano da utilizzare per eseguire l'attività fisica a casa o all'esterno o in gruppo è utile sia per gli anziani, persone con disabilità oggi, ma anche per i futuri anziani che saranno molto più abituati a utilizzare lo smartphone.
Io sono Pietro e sono la figura ponte di questo progetto che si svolge nel quartiere Navile del comune di Bologna. Il mio ruolo è quello di fare da tramite tra gli operatori iniziali che hanno organizzato il tutto e i gruppi che si sono costituiti dei vari quartieri, particolarmente quello a cui io faccio parte, che è il Navile. Un'app molto facile e semplice da usare. Oggi gli anziani sono circondati da strumenti elettronici e informatici, si devono necessariamente adeguare. Per mantenersi giovani c'è necessità di sapersi muovere e in questo l'app l'ha centrato in pieno, suggerendo i vari movimenti che bisogna fare per quanto riguarda un migliore tenore di vita, stare un pochettino meglio, non soltanto fisicamente ma anche con lo spirito, con le relazioni che comportano questi gruppi.
Sono Anna Maria Foggetti, sono una fisioterapista. Mi sono avvicinata a questo progetto perché molto sensibile a tutti quei progetti che vanno nella direzione della prevenzione. Il mio ruolo è quello di PAM, che nell'acronimo è Project Activity Manager. È stato quello all'inizio di selezionare le persone per la formazione dei gruppi, come appunto la sperimentazione prevedeva, e di condurre i gruppi durante l'attività e l'esercizio, di cercare di supervisionare le modalità di esecuzione dell'esercizio per far sì che i partecipanti potessero svolgere gli esercizi in sicurezza attraverso momenti di formazione avviati all'interno di ciascuna seduta. Abbiamo riscontrato nella maggior parte dei partecipanti un buon esito nell'utilizzo dell'app. Ho osservato notevoli miglioramenti nella maggior parte dei partecipanti, che hanno migliorato la loro postura, hanno migliorato il loro senso dell'equilibrio, quindi insomma anche il loro modo di apprendere ed eseguire l'esercizio fisico.
Okay, and it's important, as a patient or person says, that the functional strategies in physical activity and in the relationships with the group is very important to take contact with that strategy. Okay. Okay, now we changed the presentation, and I want to explain about scientific evidence. As a researcher, it's my field of expertise. And in this slides, you can observe the amount of the increasing number of publications in scientific journals of mental health physiotherapy. This is a search I was done in May of this year, and I conducted a search on PubMed, combining physical therapy and physiotherapy with mental health. I found more than 21,000 articles published on date using physical therapy, and more than 6,000 articles using physiotherapy. If we limit the search to the last 10 years, we find more than 5,000 articles. Out of these, 1,000 are randomized clinical trials, and more than 700 are systematic reviews and meta-analysis. These explain the amount of interest in this field and the advanced in the evidence. The research lines that generate the most interest and evidence are physical activity or therapeutic exercise and body awareness therapies. This kind of interventions has been assessed in several health conditions such as depression, anxiety, schizophrenia, eating disorders, and chronic pain. Thank you. Okay, this is a publication, the work of a colleague, Lidia Carballo, and she was conducted the most published topics among the 19,000 publications found. The main topics published in this field include physical activity and eating disorders and addictions. It's important, this field in the mental health is very, actually the growing in this patient, the number of these patients. Also mental health in aging, chronic disease and cancer. Additionally, topics on exercise and neurological issues, chronic pain and severe mental disorders emerge with high intensity. Thank you. And you can, another, okay. There are many studies that evaluate the effectiveness of physical activity in mental health, but I would like to highlight this particular one as it analyzes the mechanisms through which exercise proves beneficial. In this article, the authors emphasize three mechanisms. The first is hedonic effect of exercise. Everyone, when you go walking by the mountain on another trip, you feel comfortable, you feel better, well-being, yes. And induce general physical well-being. They also discuss improvement in neurobiological mechanisms, enhancing neuroplasticity in the pathways of system neurological center. And lastly, they highlight the behavioral role of exercise, such as the sense of self-efficacy and the self-regulation of the patients. The exercise could improve the behavioral with the others and the group also. Thank you. Okay. Okay, through the effectiveness of physiotherapy and in especially in mental health has been demonstrated in various chronic and acute health conditions that can be addressed through primary care. Physiotherapy have recently been included as a professional in the primary care system. Our specialty has some special characteristics that it develop agreed tools that we spend time with your patients, and we can be in contact with them. That is a very appreciated tool for creating a relationship that we can develop our biopsychosocial factors with our patients. For all that, we can establish the connection with our patients, and we can apply this approach in our interventions. Therefore, we consider it is important to include this specialty and assess the potential cost savings in socioeconomic terms that it will be entailed. It's important to have time and contact with the patient. And also a stigma has been developed, another challenge of our patients. And for us, for physiotherapists, we don't have not so much stigma in our sessions like psychologists or psychiatrists for the other people. we think that our professional specialty don't have a special stigma of our patients. Yes, thank you. Multidisciplinary team, no? The mental health physiotherapy aims to enhance or alleviate the symptoms of mental disorders through the body function and functionality. Mental health issues are complex and require a multifaceted approach. Furthermore, the body also requires attention, and this is why it can provide great value in the treatment of chronic conditions through physical activity and body awareness therapies, among other techniques. The body is our issue, is our theme, and it's important to take attention with the body of our patients because they have a lot of comorbidities, and also most of the symptoms are reflected on the body, like attentions, changes in postural pattern, and something like this. It is important to take care of that. Yes. And for last, regarding challenges and opportunities, we think the most opportunity for us is to understand the role of the physiotherapy mental health within the context of multidisciplinary team. We think we can help with a holistic view our patients, and we can help our multidisciplinary team to cope with the whole patients, not only the mental aspect, but the physical aspects too. Yes. The other challenge is adapting primary care to facilitate the integration of biopsychosocial care approach by the physiotherapists. We have time, we have contact, and we can develop treatments with this approach, and I think is very, very important, and that idea is in the line of WHO, that they want to implement holistic interviews and biopsychosocial approach in our patient, and especially mental health, because they are very complex. And this, implementing a holistic intervention that prioritizes person-centered care in primary care. Every patient is unique for us, and we can treat with their individuality, and we have a lot of tools to cope with them. And finally, thank you for your attentions, and that is my email if you want something. Thank you very much.
Thank you, Cristina. Well done for a very detailed presentation. We already have some comments coming in about the competencies of physiotherapists and what reflects in our basic education programs. Obviously, we need to, even our physiotherapy education programs reflect our population trends. As Mental Health Working Group, we are committed to present a paper on the actual core competencies of physiotherapists working in mental health, who will then be able to well inform us also through our networks within the education arena at EU level of the physiotherapy programs, to be able to actually educate the current workforce and our future workforce to make sure that we can address our health system needs in a timely manner. So I thank you, Cristina, for that. Now we go to our next intervention, which, if I may comment on a personal note, to me, it's the most important part of today because it's a patient testimonial from Spain. She's a 37-year-old female who decided to keep her anonymity during this video. She was interviewed by our colleague Cristina throughout all the interview. She has fibromyalgia, and she has shared her experiences of how physiotherapy has impacted her life and improved her quality of life. Thank you. So the video can go through. Thank you very much.
Hola, Ana. Hola, buenas. Muchísimas gracias por participar en esta entrevista. Y sabes que esta entrevista va a ser exhibida en el Parlamento. Y te iba a preguntar que para ti, ¿Qué tipo de fisioterapia recibiste y en qué consistían las sesiones de fisioterapia en salud mental que tú recibiste?
Yo recibí, bueno, hicimos 5 semanas de sesiones con 2 sesiones semanales y en esta sesión pues hacíamos diferentes movimientos. Primero empezábamos tumbados en el suelo, después sentados, después hacíamos unos movimientos de pie y después en círculo, donde tú misma, Cristina, nos guiabas y al final de todo pues había nuestra reflexión, ¿no? Que hacíamos cada uno pues sobre cómo nos habíamos sentido, si había habido pues algo diferente en ese día, en esa sesión, cómo nos habíamos notado, si había habido también alguna cosa dentro del grupo, un poco pues para hablar de todo eso. Siempre salían pues, reflexiones entre todos los que estábamos allí.
¿Y en qué te ayudó el tratamiento de fisioterapia? Y si te ayudó.
Sí, bueno, mientras lo hice durante todas esas semanas, la verdad que mejoró mi conciencia corporal y apliqué pues algunas de las posturas pues en diferentes actividades del día a día, pues como en la cocina o como a la hora, a la hora de andar, pues notar mi posición, cómo estaba, si estaba recta, la respiración, un poco pues estar más en el aquí, no estar divagando tanto, sino notar más cómo estaba mi cuerpo.
¿En qué consistía esa intervención? ¿Cómo se llamaba esa terapia?
La terapia que hacíamos era viva y era una terapia de conciencia corporal, por lo tanto era eso, ¿no? Tomar conciencia de cómo estaba nuestro cuerpo, la respiración en él, pues un poco cómo nos movíamos nosotros respecto al entorno, un poco llevado también a los ejercicios básicos, ¿no? del día a día.
¿Y qué sintomatología te mejoró?
Pues una de las partes fue el dolor en la zona de caderas y podía andar quizá un poco mejor durante toda esta época en la que también pues hacía los movimientos en casa. Y me fue muy bien también el grupo, ¿no? La terapia misma del grupo, pues también.
Y por último, la última pregunta es si tú todavía estás practicando algunos ejercicios o sigues siguiendo las recomendaciones en algún momento que se te dieron.
Bueno, ahora mismo no puedo porque bueno, mi salud empeoró, pero bueno, ahora estoy pendiente de una cirugía que sí, pues si mejoro, sí. En el momento en el que pueda moverme un poco más, pues intentaré volver a hacer algunos de los ejercicios. Todo que los de respiración y los de tumbada, pues algunos sí que puedo hacer. Pero bueno, ahora por otras patologías, pues no encuentro la ayuda que en ese momento encontré. También pues el hacerlo solo no es lo mismo que el estar en el grupo y que te guíen, y es diferente.
¿Encontraste más beneficio de estar en el grupo?
Sí. Es mejor.
¿Qué te aportó el grupo?
Bueno, también el hecho de que son personas que tienen las mismas patologías, que te entienden sin hablar mucho, que ves los movimientos y más o menos los hacen como tú, ¿no? Que no se mueven pues, perfectamente, sino que hay unas limitaciones de movilidad, pues eso hace que conectes rápidamente.
That was a good intervention from a patient of Cristina, and we have seen how basic techniques in physiotherapy can impact one's quality of life, and which even are related to functionality, to employment, to social status, to having a good network in the community and being an active member in the community. So that will definitely impact one's life, because ultimately what physiotherapists do are the techniques that we do, our interventions are to affect one's functional activity and quality of life. So I would like to start with the round of questions. Alex, I'm going to start with you. The very first time that we met, we had a very interesting conversation about social justice and the right for access to care, even in mental health. Can you perhaps elaborate a bit on how you see physiotherapy contributing to this? And perhaps you can elaborate more because we would like to dedicate some time on this matter. Thank you.
As I said, Maria-Louisa, my initial remarks, and as we have rightly witnessed directly from patients, but also from professionals, I think that access to physiotherapists and the right access in each and every member state. I think that is the biggest challenge that we always have here in the European Union, because we have members who are providing good access to professionals, especially those which are being provided by the state free of charge, especially to the most vulnerable citizens, because the biggest challenges that we have, especially when it comes to mental health, and I have seen many different cases around 6 months ago, and I always bring this example. I was visiting Richmond Foundation, and they made a presentation to me, and 2 patients came in during this presentation. A patient who came from a quite wealthy family, and another patient who came from a very disadvantaged background, let's put it like that. Both patients had the same mental health condition, same mental health issues. One became a trainer with Richmond. So from being a patient, receiving all the services, he ended up also helping out the NGO that helped him. The other one was in a totally different shape. I don't want to go into the details of the case, but you could see a stark difference when one has the means, ultimately, to be able to get all the services. In this case also, we are speaking about mental health and how physiotherapy can help our mental health, and another patient who was lacking these basic services. So I believe, and that is why I really want to push physiotherapy when it comes to the mental health strategy, because I believe that physiotherapy should be one of those services together with psychiatrists, psychologists. Physiotherapists should be partners with these 2 other professions when it comes to mental health treatment. But again, one of the biggest issues that we have when it comes to physiotherapy, as in all other professions, is access. Access when it comes to the financial means of those who are most vulnerable in our communities. Access when it comes to our healthcare systems, who have to recognize, and that is why the strategy is important, that physiotherapy is not only about rehabilitation. Physiotherapy is also an important aspect when it comes to treatment of mental health. So that is why it's so important to have a strong strategy with physiotherapy at the very center of the strategy, to be able to guide our member states in the right direction, both when it comes to social assistance and when it comes to provision in each and every one of the 27 member states, but also when it comes to changing the culture and making physiotherapy closer to mental health treatment.
Thank you very much. We'll take definitely home with us some important things that you've mentioned. It's about universal health coverage. It's about access to physiotherapy, free access to physiotherapy. And I think as well, from a physiotherapeutic point of view, we need to be able to measure our impact so that the cost effectiveness element is very much evident within the health system, and the politicians and the leaders within our systems will be able to invest. Let us also not forget, because I know you're an environmentalist at heart, that physiotherapy is one of the less impactful techniques within the health system. So our green mark is quite high. We leave CO2 emissions are very low because our techniques are very hands-on, and they leave a less impact to the environment, apart from being cheaper and also contributing to the well-being factor, which is another SDG goal that we are very proud to be promoting. So we have a lot to say in our message. Now we have to cook it well to be able to advocate. And I thank you once again for committing to mention our profession for the consultation phase or the implementation phase of the mental health strategy. A question to my colleague Cristina, because in the past days we have been asked. So practically at Parliament, Alex and his team were very kind enough to ask us to prepare a poster on the event where we decided to contain exercise in a medication box. And Cristina, can you elaborate a bit how we compare exercise prescription within our profession with regards to how one would think a pill could help, medications could help, but as physiotherapists, we promote exercise with its evidence-based approach to prescription and therefore making it more effective for our patients and clients? Let us know. Thank you.
Thank you, Maria. As you say, physical activity can consider a pill, effective pill, and or profession as a physiotherapy, we have to know that exactly dose, effective dose, and frequency, and the lasting during the time to improve our patients. And it's important to use that physical activity or that therapeutic exercise, as in other situations we can say, and is the future of our profession. Use the hands-off interventions, not, and because are cheaper, is easy to implement. We can adapt to the patients, to the preference of the patients, and when the patient have the habit, it could be alone, or it could be with autonomy in the practice of physical activity, and is our main aim, no? Self-care of our patients, not, or help to our patients to take care of selves. And for us, it's very, very important, the physical activity, and it's a new line of the future of the physiotherapy.
Thank you, Cristina, and well done, because we have seen in the video that your patient really knew how and where and when to do her exercises. So it was the practical part of how, when we are actually in our clinical setting and giving advice, we could see in our testimonial how the patient, your client, adapted her exercise program and her functional daily activities. So we have some comments that I would like to cover, but there aren't any specific questions. But please, for our online participants, please do know that we are taking note of all the comments and we'll keep them in mind even for policy making design in our future. Some of you as online participants have asked us if they can be reach out to the European region, and all I can tell you is, if you're comfortable in writing your email in the chat, please do so, and then we will transcribe it and we'll keep it. And even for future events, we'll send you the invite, or feel free to contact us directly at the Secretariat. You can find our generic email on the website, and we will have time to connect and network at a later stage. One final question, Alex? Yes. So with regards to what's next, what do you think is next? How shall we proceed? What targets do we have as profession? We definitely are all ears, all eyes, and Esther-Mary got her pen as well, I can see, right? We continue taking notes. So what do you think, what would you suggest us as a whole group of European movement in our profession?
So I think that, first of all, the most important thing is to continue to advocate and explain. Because ultimately, I understood more the correlation between mental health and also your profession after the discussions that we had, Maria-Louisa, when you came forward and spoke about your organization and how you are also prioritizing when it comes to mental health. So advocating not only within the European Parliament, but within each and every member state with your representatives, I think that is a very important thing when it comes to lobbying with the Commission, with MEPs, especially at this very juncture. This is a golden opportunity that we have. Maria mentioned the issue of more visibility when it comes to mental health. We always had these numbers when it comes to citizens feeling that they have bad mental health or mental health issues. But Now we are having a more political focus on mental health, especially post-COVID and during COVID. So people are coming out more, they are speaking out more, taboos are still there, but political visibility, if until 3 years ago, let's put it like that, I don't like to use the word sexy campaign, but the sexiest campaign were children's rights, domestic violence, women's rights. They are all very important topics. But mental health was always sidelined. Why? Because we didn't get enough prominent persons, people, politicians to speak out. And when you don't have this affiliation and you see someone who is a politician, who is someone that you admire, who will come out and say, I also frequently, rarely, sometimes pass from these issues and I seek help. So visibility now is at its very best. So it's really important, especially after years and years of trying to push the European Commission, having now a commissioner, Stella Kyriakides maybe, which is more sensible to the issue of mental health, having a commission which became more sensible on the importance of pushing forward the strategy. I think that the most important thing is not to make a one-off event here in the European Parliament, but to continue advocating, to continue also trying to use European funds to set up projects like the one that Cristina also pointed out, and we saw this positive impact, positive experiences from our citizens. So I think this is the biggest chunk of work that you have to do. Okay. Visibility and joining the dots, especially now that we are working on the strategy. It's a golden opportunity for you to be central in that.
Okay, points taken. So it's time for us to conclude. It's been a very interesting 1.5 hours. We've worked hard for this, and I think it couldn't have gone better. I usually like to take notes when I chair sessions, just for me to have my take-home messages. So from Esther-Mary, very clear message: remain in sports, do physical activity. If you are elder, have disability issues, do movements related to your functional activity, movement awareness, and also remember exercise can be prescribed. With regards to Maria, she said universal access to mental health, and we need to connect the dots at every level of policy making. With regards to Alex, he spoke about our future vision, that we need to be there, we need to join the dots. Something important in his speech was tackling mental health in a horizontal way. Pillars like social, employment, environmental, and to involve all the stakeholders. So we physios, even at national level, we could go into household matters because we are the experts on how to adapt homes through disability matters. So remember the other side of the perspective of the context. From what Cristina said, we need to remember our exercise prescription and what we picked up from Alex, even to be sensitive in our subjective, to pick up patients who come for other diagnoses if they have any mental health related issues, and to help them. I will definitely start listening to the answer when I ask, how are you? And see if the patient in front of me is okay, and try and perhaps take my time to decipher even the non-verbals. We have heard about the best practice forum, which I'm very interested to look into and see eventually if we can contribute to it as physiotherapy profession. It's the time to conclude. I wish to thank all my dear guests and also the online participants that have contributed to today. I wish to thank MEP Maria Walsh, and also remind you that after here you can visit her art exhibition straight on the way in after the escalators, actually before the escalators now because we're going out. Thank my dear colleague Cristina Bravo, who works tirelessly together with our mental health working group. I wish to thank the patient who was very courageous to give us our testimonial, and she definitely enriched our event. So Cristina, please do pass the message for us. And the heartfelt thanks goes to Elena. Hello, Elena. Thank you. To Aitor and to Miguel, our team who has worked really hard for this event and made it a success today. Finally, I'm going to thank you, Alex. I'm going to tell you Maltese. Grazie min qalb. Thank you,
Pleasure.
heartfelt thanks. So it was we started off with a very nice meeting, and to tell you the truth, I think it's less than a year than we met. We got to do something like this. You have definitely a special place in our organization, and we thank you for the opportunity together with Maria. It's time to conclude, dear guests. Thank you for your energy. Esther-Mary, as a final thank you as chair and as leading us through, because you've been an amazing leader and you have encouraged us, especially in the first phases of our work, which wasn't so easy to explore. I thank the online participants for joining us from all over the world. I'm seeing Esther-Mary, right? Because I know you've counted the countries. And the Maltese, I would like to tell you, Saha, il-wara nofsenar it-tajjeb. And thank you very much. Hope to see you very soon at another event of Europe region of World Physiotherapy. Thank you and good afternoon. Thank you.
Thank you.